Hi guys, welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. Can I treat cancer in humans? So make sure to watch the full video. Can artificial intelligence provide a new and improved perspective on cancer? On a computer screen, there are two parallel black and white images of hazy forms. The fuzzy objects on the left side are what Ismail Turkby, MD, a radiologist with 15 years of experience, thinks to be prostate cancer that is crawling and expanding. The same thing has been done on the opposite side of the screen by an artificial intelligence, AI, computer program, and the outcomes are remarkably similar. The MRI scan in black and white is from a patient with prostate cancer, and the AI software has examined many of them. Dr. Turkby continues, without any human supervision, the AI program discovers the prostate and highlights cancer suspicious areas. He believes the AI will assist less experienced radiologists in detecting prostate cancer when it is present and ignoring anything that can be confused for the disease. When it comes to the nexus between artificial intelligence and cancer research, this model is just the beginning. Although the potential uses are seemingly limitless, a lot of the advancements have been made in cancer imaging tools. Imaging tests are used by doctors in a variety of ways, from taking X-rays of entire organs to taking images of cancer cells under a microscope. They can also be used to diagnose tumor stages, monitor the effectiveness of treatment, and discover cancer in its early stages. Researchers have created AI technologies that could speed up, improve the accuracy, and even increase the educational value of cancer imaging during the past few years. And all of it has caused a lot of enthusiasm. According to Stephanie Harmon, PhD, a data scientist at the NCI's molecular imaging branch, there's a lot of hype around AI, but there's a lot of research that's going into it as well. According to experts, this research will address issues including whether these technologies are prepared to leave research labs and enter medical offices, if they will genuinely benefit patients, and whether that advantage will accrue to all patients or just a subset of them. How does artificial intelligence work? Computer algorithms or programs that use data to derive conclusions or forecasts are referred to as artificial intelligence. Scientists may develop a set of guidelines or instructions for the computer to follow in order to establish an algorithm that will allow it to process data and reach a conclusion. Dr. Turkby and his associates, for instance, utilized accepted guidelines for how prostate cancer appears on an MRI scan. Then, they used tens of thousands of MRI scans, some from men with prostate cancer and some from men without, to train their algorithm. The algorithm learns how to evaluate and understand data by itself when using other artificial intelligence techniques, such as machine learning. As a result, machine learning algorithms may recognize patterns that the human eye or brain would find difficult to identify. Additionally, as these algorithms encounter more fresh data, they become better at understanding it. Applications for cancer imaging have also been developed using deep learning, a subset of machine learning. Deep learning is the term for algorithms that categorize data in ways akin to how the human brain does. Deep learning technologies employ artificial neural networks that resemble how our brain cells receive, interpret, and respond to messages from the rest of our body. Studying AI for cancer imaging. Malignant imaging tests are used by doctors to determine a variety of issues, such as, is the lump malignant or healthy? How quickly is the cancer growing if it is? How far did it get? Is it returning after treatment? According to studies, AI may increase the reliability, speed, and accuracy of medical professionals' responses. According to Hugo Ertz, PhD, of Harvard Medical School, AI can automate evaluations and tasks that humans can currently do but take a lot of time. Upon receiving a result from the AI, a radiologist simply needs to review what the AI has done. Did it make the correct assessment? Dr. Ertz went on. He continued, but that still needs to be proven. Automation is supposed to save time and money. Dr. Ertz added that AI may also make the extremely subjective role of visual interpretation simpler and more accurate. We see significant advances being made with deep learning in complex activities that need a human making an interpretation of an image, say, a radiologist, a dermatologist, or a pathologist, he said. However, the possibility that AI will surpass what humans are currently capable of doing themselves is what scientists are most excited about. AI is able to see things that humans are unable to, and can identify intricate patterns and connections across a wide variety of data types. Dr. Ertz remarked, AI is amazing at accomplishing this, at going beyond human competence for a variety of things. However, it's challenging for doctors and researchers to determine whether the tool is operating properly in this case, because it's frequently unclear how the AI comes to its conclusion. Early cancer diagnosis. Regular screenings for cancer and cells that could develop into cancer, such as mammography and Pap tests, are performed on patients. Early detection and treatment of cancer are priorities in order to prevent it from developing or even spreading. To help with screening tests for numerous types of cancer, including breast cancer, scientists have created AI technologies. For more than 20 years, doctors have utilized AI-based computer algorithms to aid in the interpretation of mammograms, but the field of study is rapidly developing. One team developed an AI algorithm that can assist in deciding how frequently a person should undergo a breast cancer screening. To determine a person's likelihood of acquiring breast cancer during the following 5 years, the model analyzes their mammography pictures. The model performed better in testing than the methods currently in use to estimate the risk of breast cancer. A deep learning algorithm developed and evaluated by NCI researchers can recognize cervical precancers that need to be removed or treated. Health professionals may use a tiny camera to examine the cervix in low-resource situations to check for cervical precancer. The simplicity and sustainability of this system mask its lack of accuracy and dependability. In order to enhance the effectiveness of the visual inspection method for detecting cervical precancers, Mark Schiffman, MD, MPH, of the NCI's Division of Cancer Epidemiology and Genetics, and his colleagues created an algorithm. The system outperformed trained professionals in a 2019 research. AI for cancer diagnosis offers the ability to help people with symptoms better detect their disease. For example, using a relatively new type of prostate MRI scan called multiparametric MRI, the AI model created by Dr. Turkby and his colleagues in the NCI's Center for Cancer Research may make it simpler for radiologists to identify possibly aggressive prostate cancer. According to Dr. Turkby, the NCI team's AI model can minimize the error rate and make the learning curve easier for practicing radiologists. According to him, the AI model might act as a virtual expert to teach less experienced radiologists how to use multiparametric MRI. In order to help clinicians detect lung cancer on CT scans, a number of deep learning AI models have been built. On CT scans, some benign lung changes can be mistaken for cancer. As a result, a lot of people receive false positive test results for lung cancer when they don't actually have it, picking a cancer treatment. Additionally, imaging tests are used by doctors to gather crucial data on cancer, such as the rate of growth, the presence of spread, and the likelihood of recurrence following treatment. Doctors using this information can select the best course of treatment for their patients. According to several research, AI may be able to more accurately and efficiently extract prognostic data from imaging scans than humans currently are, possibly even more. For instance, Dr. Harmon and her associates developed a deep learning model that can estimate the possibility that a patient with bladder cancer may require additional therapies in addition to surgery. The majority of patients with tumors in the bladder muscle-invasive bladder cancer, have clusters of cancer cells that have moved outside of the bladder, but are too small to be detected with conventional methods, according to medical professionals. If these undetected cells aren't eliminated, they may keep growing even after surgery, leading to a recurrence. These little clusters of cancer cells can be destroyed by chemotherapy, which also stops the disease from returning following surgery. However, clinical trials have shown that it can be challenging to decide which patients require chemotherapy in addition to surgery, according to Dr. Harmon. What we would like to do is use this model before patients undergo any sort of treatment to tell which patients have cancer with a high likelihood of spreading, so doctors can make informed decisions, she said. So, that's it for today. We hope you enjoyed the video. Use the comment section below to tell us your thoughts about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.